Greetings, this is Dr. Jamie P. Motley. I specialize in musculoskeletal radiology, and today we're going to do a brief tutorial on the cervical spine anatomy of the atypical cervical vertebrae. A standard series will include an AP open mouth projection, in which we're visualizing right now, an AP cervical projection, as well as a lateral cervical neutral projection. When thinking about the atlas is a ring-like structure, and I'm going to draw you a little diagram. Anterior arch, lateral masses, posterior arch. Now the anterior arch has a little anterior tubercle. This is anterior, this is posterior. Now when we look at the atlas from an A to P direction, what we're going to see best are going to be these lateral masses with their transverse processes extending from them. So now let's come down to our cervical C1 segment. First I'm going to outline the lateral masses. They look like these wedge-like structures on both sides of the odontoid process. Now, the lateral masses contain articular facets. The superior facet of C1 will articulate with the occipital condyles bilaterally. The inferior articular facet will articulate with the C2 segment. The transverse processes are visualized extending off of the lateral masses like we discussed in our diagram. And the anterior and posterior arches are also seen. Now this is not the optimal projection to see the anterior and posterior arch, however you do see the shadow of them. One of the dilemmas to AP open mouth projections is that the superimposition of the anterior or posterior arch on the dens can actually create this lucency, which we call a mock band effect, and can simulate a fracture of the odontoid process. The tongue can do a similar phenomenon, so just be careful when you're looking at the densities in this region. Now moving on to C2, here is the odontoid process, often referred to as the dens for short. This attaches to the C2 body. The dens has a tip and it has a base and attaches to the C2 body. Now I'm outlining the rest of the C2 body. You'll notice that again the articular surfaces of C2 superiorly will articulate with the lateral masses of C1. You realize why that's important once we get to the lateral projection, because the facet articulation between C2 and C3 is actually located more posteriorward in the posterior arch. And well, typically we can see pedicles, which would be in this region. This patient wasn't able to open their mouth actually wide enough, however they would be visualized in that location, as well as the spinous process, which is covered up by the teeth in this case. Now, one of the important things that we need to look at, especially in traumatic situations, is the para-odontoid space. Now, para, prefix meaning next to or around, and odontoid, you can see how we're referring to the space next to the odontoid bilaterally. This para-odontoid space should be equidistant bilaterally. Other structures that are seen on AP open mouth projections are the mandible. In this case, here's the mandibular ramus on the right and the mandibular ramus on the left. You can also see mastoid air cells on both sides, and of course the teeth. Now, the radio-opaqueness that you see in the region of the skull is because of the thickness of the structures in that region. So the AP open mouth projection, again, is just to visualize the upper cervical segments. Now, the lateral cervical neutral projection is useful to see the spine in the sagittal plane. We can see the vertebral segments very well, as well as the posterior arch and all their associated anatomy, which we will cover today. I wanted to continue with C1 segment and demonstrate the anterior and posterior arch for you so that you can see it in a different perspective. On the lateral cervical neutral, the anterior arch of atlas is visualized in this location. I'm going to make my pen size a little bit smaller because that line is a little too big for what we need here. Now the posterior arch is visualized here. Now for some of you more experienced viewers, you'll notice that this patient has this density here. It's just calcification of the atlanto-occipital membrane in the region of the arcuate ligament. There's some debate about whether it's truly an incidental finding or not, but for our purposes, we'll just kind of point it out. Here is the Odontoid process, again well known as the dens, and you'll notice that there's a space between the anterior arch of atlas and the dens. Now I just want to draw you another rough diagram just to kind of depict what this space actually is. Here's the anterior arch, again lateral masses, posterior arch. Now this is a bird's eye view. Right behind the anterior arch is the dens. The space that we're currently assessing is the space between the anterior arch and the odontoid process. This is known as the atlantodental interval or the atlantodental interspace. Now this space is significant because there's an important structure that lives in this region called the transverse ligament. And the transverse ligament wraps itself around the dens and attaches to the anterior arch of atlas. This ligament is very important because it keeps C1 and C2 together. Since we can't see the ligament radiographically, we have to assess its integrity by this space. Now this space should not exceed 3 millimeters in adults. If this measurement exceeds 3 millimeters in adult, this is problematic and follow-up must be done. To continue on with the anatomy, here's the C2 body. I'm just going to switch back to red, which I think is more easily seen here. Vertebral body. Now remember in the cervical spine that the transverse processes extend from the body laterally, and it's a U-shaped structure. This structure is going to be visualized within the vertebral segments. You cannot tell right from left as we have no depth perception, but we can see the U-shaped density of the transverse processes. I think it's important for us to understand the order of anatomy from front to back. Here's another bird's eye view drawing. This is anterior, this will be posterior. Here's a vertebral body, pedicles, articular pillar, lamina, spinous process. So when we move from anterior, first comes the body, followed by the pedicle, followed by the articular pillar, lamina, spinous process. Once we go back to the projection, we'll notice that the most anterior structure is the vertebral body. Now the vertebral body has superior and inferior end plates in which the intervertebral disc attaches. Now when we think about what comes next, the pedicle. So the next structure just posterior is going to be the pedicle. This is very short appearing in the cervical spine as the pedicles do extend in a posterolateral orientation, and so on the lateral projection they appear foreshortened. Next comes the articular pillar. Here is the articular pillar of a segment. On the articular pillar lives the articular facet. There's a superior articular facet and there's an inferior articular facet, and that's present on all the cervical vertebrae that are typical. Now I just want to bring you back up to C2 because C2, here's the pedicle and here's the articular pillar, but what do you notice? There's only an inferior articular facet on the articular pillar. Remember from our AP open mouth projection that the articular facet, the superior articular facet of C2 actually lives on the body of C2 and is well seen on the AP open mouth projection. To continue on with our anatomy, what comes next? The lamina. Here are the lamina, followed by the spinous process. Now, you all will notice this very conspicuous white line here on the posterior arch of each vertebrae. This is the spino-laminar junction. This is actually the junction point between the lamina and the spinous process. Now, because the bone is so thick in that location, it's very radiographically dense, and so we see that line very well. If that line is not visualized, let's say on this bird's eye view, there's a midline defect, there will be no radiographically visible spino-laminar junction. This is called Spina Bifida occulta, and this Spina Bifida occulta is characterized by a midline defect at the posterior arch. There are more serious types of spina bifida that will have protruding contents through that cleft and are more serious and surgically repaired. However, the occulta type is usually not detected simply because it's typically a incidental finding. And lastly, spinous process. Now there are other things that you can see on cervical radiographs, lateral projection, specifically prevertebral soft tissues. All this gray that is anterior to the vertebral bodies is actually the prevertebral soft tissue, and it's named for the airspace that lives in front of it. This tissue is important, especially in traumatic situations where there has been damage to the osseous structures or even the soft tissue. This region will distend. Here's the airway, here's the mandibular angle, and of course you can see portions of the skull and of the face. Oh, I forgot one piece of anatomy, and that is the uncinate process. Does everyone notice this kind of curvilinear radiopacity present within the disc space? This is actually the uncinate process. The uncinate process is a lip-like structure that circumferentially surrounds the vertebral body, beginning on the lateral aspect and moving posteriorward. And these actually make a joint with the vertebral body above, making the uncovertebral joint. These are better seen on the AP projection. We are now going to move on to the AP cervical projection, which demonstrates the lower cervical vertebrae in the frontal plane very well. Let's start by identifying the vertebral bodies. Since there's a lordosis in the cervical spine, on the AP projection, the vertebral bodies do not look exactly square, but are still very well visualized. Here's your superior end plate and your inferior end plate. Next vertebrae down, and so on and so forth. Now, what can be difficult in this projection is to identify what segment you are visualizing. Now, one trick of the trade is to come down to the first thoracic segment, which is typically characterized by articulating with the first rib that you see here very well. Now, the problem with just using the first rib is that sometimes patients have anomalies, such as cervical ribs, in which case they may have a rib actually extending from C7 most commonly. So, a more reliable indicator that you are actually at a T1 segment is the position of the transverse processes. Notice that the T1 segment, this is T1, has transverse processes that are extending into a superior word position. I'm going to draw your attention up to C6 and notice that the transverse processes are pointing down. This is a very reliable way to tell the difference between C7 and T1, and therefore allowing you to count your segments correctly. Now, we talked about the vertebral bodies. Something else I wanted to touch on were those uncinate processes, because you can see them much better on the AP projection of the cervical spine, to these sharp ear-like structures that are extending off the most lateral aspect of the vertebral body superiorly. These are your uncinate processes, and these uncinate processes actually articulate with the segment above, making that nice uncovertebral joint. Next, intervertebral disc spaces will be between the superior end plate of the lower vertebrae and the inferior end plate of the upper vertebrae, and is perceived as a lucent area. The pedicles are these very dense circular-like structures. Remember, they extend posterolaterally off the vertebral body. The next structure we're going to visualize is the articular pillars. Now, everything lateral to the pedicles and to the body are going to be articular pillar. This whole linear region of osseous structure is the articular pillars of each cervical vertebrae. Now, remember, we saw the joint space of the facets very well on the lateral projection due to their orientation. While on a frontal projection, we don't see through the joint space, and therefore these articular pillars look like one dense piece of bone. Lastly, spinous processes. Oh, got a little ahead of myself there. I said lastly, but we actually need to identify the TPs. Now, remember that the transverse processes do extend off of the body, and they're typically pretty small on the cervical spine. We're catching the margin of a few of them. These are not typically very well seen. Now, the rest of the structures we have to consider, again, ribs. Here's the first rib, extending from the T1 transverse process. Here's the second rib, and the third rib, which we can see very well on both sides. Do not confuse this with the clavicle. In this patient, the clavicle is actually beginning down here, and we don't see it very well. Now, in terms of soft tissue structures, we have to account for the tracheal air shadow. If you look closely, there's this more lucent area That's usually visualized in the midline of the spine if the patient's not rotated. This air column is the tracheal air shadow. This should be midline. Lastly, we need to assess the lung apices. There are some big, bad, nasty things that can occur in lung apices, and it's really important that we just visualize them to make sure there's no abnormalities in that location, even though this is a cervical spine projection. If you did see an abnormality, you would want to take a chest radiograph to better visualize that area. I hope this anatomic tutorial was useful, and please join us for future tutorials.